Guten Tag, my name is Matthias Wienold, and I would like to introduce myself to you as a member of the patient panel of the British Medical Journal. I first started reading the BMJ as a medical student when I was looking for practical information on HIV testing. In the early 1980s, a friend of mine had tested HIV positive, and he was refused consultation at the medical school's clinic in Germany that I attended. When I attended a discussion among gay men a couple of months later, I realized that I had become the expert in the room. As a medical student and as a young physician, I learned that patients came in different categories. They were lovely and difficult, acute and chronic, young and old, male and female. In dermatology, I learned about races too. But here were homosexual men and drug users in a crisis. I have since belonged to an at-risk patient group. I'm also a patient because I have a rare headache disease known as cluster headache syndrome. I found myself in the social role of a patient representative for the first time when I was elected chair of a small AIDS service organization in 1987. And I met empowered patients and advocates fighting with me for destigmatization and for improvement in community-based care. I became a convert to the slogan that patients speak best for themselves. It is our voice that counts. I believe that the only path to better health leads through the needs that we present as patient communities. I became a regular visitor to international AIDS conferences, and I started contributing my own research. In my advocacy, I've focused a lot on the development of new drug treatments and getting them into the hands of people. I was labeled a treatment and community activist. I was labeled a patient advocate and a patient expert, or even a patient researcher. I became a patient champion for patient safety through the World Health Organization, and I served on the governing board of the International Alliance of Patient Organizations. My current research and advocacy focuses on medical education. If you would like to engage with me, please follow my texts in the BMJ and comment on them. Thank you. Dankeschön.